Have you thought about using technology in your classroom, but you were too intimidated because you weren't sure that it would work properly? You're not alone. So many of us as educators think about trying a new technology, a new strategy, but it never happens because we're too afraid that it will become a barrier to learning and we'll get frustrated, and so we never try it out. Welcome back, everybody, to Dr. Sellers Educate. Our mission is simple: to support all nurse educator colleagues to achieve success on the CNE exam and to become a better nurse educator in the classroom. If this is the first time that you are tuning into our channel, welcome. We're glad that you're here. Make sure you subscribe. That way you'll be notified every single time a new episode is released. If you're returning, we're excited that you're back, and we want to make sure that everybody has printed out their study worksheet. It is located right here in the description of this snapshot, and this will help ensure that you stay focused during our time together by looking at that worksheet, writing down the date. Okay, so that's the first step. Write down today's date, whatever date you're watching this snapshot. And number two, write down the objective. What is it that you want to achieve as part of your time together with us today? We know that everybody is busy, and we want to make sure that you are best utilizing your time to stay focused, and we want to make sure we meet your objective as well. In this series of snapshots, we're going to be looking at innovative ways to help us be a better nurse educator in the classroom. Technology is centered around how do we engage the learner in a way that we are going to positively influence the educational experience. That requires us to be properly prepared. Whenever we show up in the classroom, we have to review the content that we are going to cover, and we want to add engaging strategies. Now listen to this. This was research that I discovered when I was developing content for this snapshot. Research says that as adults, when we're engaging in a presentation of any kind, whether that's work or if we're in a classroom setting, we start to lose attention and engagement and become bored at the 8 to 9 minute mark. Is that not surprising to everybody? For some, you may feel like you become bored at the 3-minute mark, right? Depending on the topic that is being discussed. This data was based on an analysis of our heart rate and our breathing. So it wasn't self-reported data, which I found to be fascinating. It really was looking at how our bodies are responding when we get to that 8 and 9 minute mark. In education, we like to use a concept that some of us call sandwiching, where we're layering content in our classroom experiences that is going to actively engage the student, but also help them better understand concepts. So I like a sandwiching approach where we're kind of breaking up the monotony a little bit. That's something that we like to use here at Dr. Sellers Educate as well. So let's take a look at our content for today by starting with our thought-provoking question. In a nursing education program, students are tasked with learning about wound care management. Rather than solely attending lectures, the faculty are designing engaging active learning sessions. In what ways can active learning, particularly through the use of videos, benefit adult learners such as nursing students in educational settings? So we have three options. A, by providing passive observation opportunities, thereby reducing cognitive load. B, by completing traditional lecture-based methods with PowerPoint slides with detailed content. Or C, by fostering critical thinking skills and encouraging application of concepts through interactive engagement. Now, when we look at our thought-provoking questions, the goal is that they will do exactly that. We want to stimulate thought. We don't write exam questions for NLN. That would be a conflict of interest. We simply want you to think about concepts that we are describing in our thought-provoking questions. We want you to go back and take a look at Billings and Halstead, Teaching and Nursing. It is the 6th edition that you should be using to make sure that you are closing your knowledge gaps and able to engage in integrating active teaching strategies that are going to engage our learners in the classroom. Okay, and if you have that textbook in front of you, excellent. You want to turn to chapter 16. This is where you're going to see a lot of description around active learning strategies that we want to use in our classroom. And this starts on page 286, again in Billings and Halstead, Teaching and Learning. On page 288 is where you're going to see table 16.1, where it talks about the different knowledge dimensions of revised Bloom's taxonomy. Remembering that there are 3 learning domains. When we engage in active learning, we want to align our strategies with purpose, right? We should look at our learning objectives. We should look at our exam questions to ensure that the teaching strategies we're using align with content and have a purpose by accomplishing an objective, and that we are mapping it back to our exam questions as well. Peer learning on page 289 is a great example of a teaching strategy that allows us to engage our learners. So how can we do that? Breaking up into small groups. I love to use breakout rooms. I know sometimes they can be a bit challenging, especially if some of us are multitasking when we're attending a webinar, but breakout rooms on Zoom is another great way to engage our learner. All right, so we're going to now explore some content, and before we end our time together, we will cover our thought-provoking question. Engagement. There are many benefits to engagement, but the one I want to focus on is increased retention. Cinematic education is an example of an activity that we can use to engage our learners in the thought-provoking process of learning, right? It's a cyclical process that we want to make sure our learners are fully able to engage in that learning process. And when we look at cinematic education, I want us to take a look at this short snapshot describing the importance of us engaging our students in a different way of learning. So take a look at this video. You can see it's titled The Power of Teamwork. It's kind of funny. There are different video clips you could grab from YouTube and other resources, but let's take a look at this one and then we'll talk about it. It's smarter to travel in groups. How about that? All right, here's another one. Wow, pretty powerful, right? And that first clip, what we saw was the power of unity, right? Being able to work together to accomplish a goal. That well was moving forward pretty swiftly, right? And there was no verbal communication in this first snapshot, but look at the end result. They were able to collaboratively work together in a way that effectively accomplished a human goal. And then what about this second one? What I love about this second one is they clearly communicated, right? They were given direction. Come on, come on, come on. Let's get together. You go here, you go there. Well, in healthcare, that's so important that we effectively work together to accomplish a common goal. We have to have leaders. We have to have followers. It's no different in the classroom. We, as the educator, we are a primary leader. However, we want to collaborate and partner with our nursing students so that they too are participants when it comes to leading a team to success so that we can all be successful and accomplish a common goal. Okay, so let's go back and take a look at the very last one and then we'll talk about it. So what do you think about that one? Well, there wasn't as much communication in that third one, but did you see the visual that was happening with this picture, right? They pulled together their claws. There was a demonstration, right? Psychomotor learning. There was role modeling, right? There wasn't a lot of communication, but they all knew what to do. They all lined up and collaboratively they pulled together to accomplish a common goal. Well, in nursing education, that is what we're seeking to do, right? We are hoping to come together for a common goal to be accomplished so that our students will be successful in the classroom. That's just one example of cinematic education, but as I mentioned, you can show an entire video. What's important to do is make sure, yes, we're increasing retention because students see an animation, right? They get excited, but we want to map it back to an objective, just like I did. You want to talk about the purpose of reviewing that clip. There are several on YouTube that you can take advantage of. Like I said, just make sure you're mapping it back to an actual purpose and an objective. The second focus we want to have as we wrap up is application. Increasing interactivity amongst our students, within our groups, is going to foster this sense of community. It's going to foster a sense of excellence where we're all collectively working together to understand those concepts, because we know in nursing education, we're developing partnerships with our students. We're focused on the teaching process, but we have to be a student in the process. We have to learn as we are developing and pulling together facts for our students, evidence-based facts, to bring into the classroom as we seek to transfer knowledge. So this enhanced interactivity includes us as nurse educators being able to engage with our students in a way that we can validate learning in an engaging, innovative way. So we have to be able to think out of the box. We want to bring in real-world application. Simulation is a wonderful way to do that. And we are able to engage in personalized learning. A key step in our process of engaging with our students is knowing who's in the room, asking them to complete a learning styles inventory or a VARC assessment so we better understand how they learn. And most importantly, our individual students can best understand how they learn as well. We want them to advocate to ensure that they are learning through the journey of us developing these evidence-based teaching practices. We don't want to just teach to check a box. We want to ensure that learning has happened. We want to partner with our students, enable for that to happen in the most effective and efficient way possible. All right, so let's take a look at our thought-provoking question. Hopefully, this snapshot has provided some considerations for you all as you think about, how am I going to engage my students even more tomorrow, now that you've watched this snapshot, or maybe even today, than you had previously. Okay, so if you chose C for our thought-provoking question as your answer, you are correct. Rather than solely attending lectures, which we know only 5% of retention is captured whenever we only use lectures. And we also know that it does not engage with all 4 learning styles. That's the Finch model that we often talk about. Okay, so if you chose C, give yourselves a pat on the back. And if you did not, we don't want you beating yourself up about it, okay? You want to look at the content that it is, again, in Chapter 16 of Billings and Halstead. So rather than solely attending lectures, students are able to engage in these active learning sessions where they can watch video demonstrations of various wound care techniques as an example. Afterward, they could participate in hands-on workshops where they practice these techniques on lifelike mannequins. We know staging wounds is an important part of a nursing assessment. So we want to be able to engage students in a way where they can immediately apply that content that they have learned in order for them to scaffold above that lowest level of remembering. Okay, so we want them to know the stages of wounds and what it looks like, but we want them to most importantly be able to apply it. This active learning approach not only enhances their understanding of wound care, but it also helps them hone in on their practice skills. We're able to engage with our students in a way to support active learning and formative learning, where we are giving them feedback and ultimately validating that learning has happened through a summative evaluation. This is going to conclude our time together for this snapshot. Reach out to us if you have any questions, info@drsoleseducate.com. We hope you have a great one, and we'll see you in the next snapshot.